Equity in healthcare isn't optional. It's essential. At Provincial Health Services Authority, the Diversity, Equity, and Inclusion team is leading transformative change across the province.
So my ideal for this system, I think it's a big dream, but it's that everybody feels safe and heard when they come into the system. So we provide the best patient care, and staff love it here. They want to be here forever and continue to do great work.
The DEI team's work intersects education, policy, and systems change, yielding initiatives such as the Self-ID and Workplace Experience Survey to better understand PHSA's diverse workforce, Canada's first Equity in Healthcare certificate, training to help staff deliver culturally safe and equitable care, the Accessibility Committee, streamlining accessibility across the province, the Redress or Preferential Hiring Program to retain, hire, and support more staff from equity-deserving groups, and PHSA's first anti-racism and anti-discrimination policy.
The anti-racism and anti-discrimination policy helps us track how well and how inclusive our workplace is. The policy helps us to have an accountability measure where people know how to report these incidents of racism and discrimination, and then we can track how the reporting happens and how response happens. And at the end of the day, we can see how we are shifting our culture as an organization.
And the results speak for themselves. More than 9,000 staff shared their voices through the Self-ID and Workplace Experience Survey. The Equity in Healthcare certificate inspired one BC cancer medical oncologist to say, "I enrolled in the course with some trepidation, but I've been surprised by how the modules revealed the real value of engaging deeply with DEI concepts." Over 4,800 PHSA staff have completed courses like DEI Basics, Racism Basics, Anti-Racism Education, and Accessibility and Inclusive Leadership. And this year, the team launched the Anti-Racism and Anti-Discrimination Policy and trained nearly all 268 people and culture staff on how to put it into action.
Health Equity Certificate Program was developed in partnership with Simon Fraser University. This program is first in Canada. It offers a flexible learning and learning opportunity that responds to the needs of frontline healthcare providers. From examining power and privilege to engaging with inclusive leadership, clinical and non-clinical healthcare professionals acquire the skills to work with diverse populations and to make equitable decisions.
I think we have the best DEI team in all of Canada. Full stop.
We all work really hard to embody the values that we espouse, and then that helps how we show up with our colleagues, with our partners, with our patients as well.
I hope to see an organization where every single patient and staff feel heard and feel seen and valued.
Congratulations to the Diversity, Equity, and Inclusion team at Provincial Health Services Authority for leading the way to equitable, anti-racist, culturally safe healthcare across BC.